녹화만 하시면 돼요. 그래서 물어봤어요. 두 분은 좀 다 많이 찍으라고 하시고.
Hello, ladies and gentlemen. I would like to thank you all for your participation in the World Journalist Conference 2020. I'm Park Shi-soo, a journalist at the Korea Times and host of today's conference in the capacity of chairman of the International Exchange Division of the Journalist Association of Korea. Today's topic is COVID-19. I expect presenters will give us ample knowledge and information about what kind of measures their countries have adopted to fight the virus, their impact on local communities, economy, livelihood, and many other issues. Also, we will be able to look into adverse effects these measures might have brought about. Considering the fact that the pandemic still remains robust and the availability of viable vaccines and treatments are still up in the air, today's presentation and following debate will give us a precious opportunity to draw a clear picture on what kind of actions, ideas, and policies are needed to contain the virus effectively, and at the same time, the role of the media and journalists in fight against the pandemic. Today we have 21 speakers. Of them, I would like to extend my special gratitude to Mr. Kwon Jun-woo because he's one of the key frontline warriors commanding South Korea's quarantine campaign as director of the National Institute of Health. We'll soon show you his video presentation and he will join the Q&A session that will take place in the later part of this conference in spite of a very, very busy schedule. So first of all, thank you, Mr. Kwon, for your participation. And once again, I welcome all of you. As I mentioned, today we have 21 speakers and they will soon show their presentation. And today we'll take a look at each country's quarantine systems and countermeasures for COVID-19. So if you have any questions regarding the presentation, please leave your message on Zoom chat in form of a presenter's number, name, and nationality and question briefly. Please designate the presenter you want to ask. After all the presentations are conducted, we will have a Q&A session. The presentation order of the presenters is shown on the screen. So please remember and prepare your presentation order. So because we have a limited time, I will give each speaker only 4 minutes, so please get your presentation done within the time. So you will be able to see a stopwatch with a 4-minute setting on the top right side of your screen. So please keep in mind that you have 4 minutes for your presentation. If you go beyond that, I can cut it shortly. So please keep in mind, and I seek your understanding as well. So let's go to the first presenter, who is Mr. Kwon Jun-woo, the Director of the National Institute of Health. His presentation was pre-recorded.
Greetings from Korea. My name is Jun Kwon, the Director of the Korean National Institute of Health. It is my great honor to share my experience and the lessons learned on responding to COVID-19 in the Republic of Korea. Next. First, I will briefly go over the current situation in Korea. Next. In Korea, the peak of the transmission so far was on February 29, with a record of 909 confirmed cases in a single day. After that, newly added cases have slowly decreased. Since March 12, the number of daily confirmed cases decreased on the 10th year early May. However, after relaxing to a new routine distancing in daily life, the number of cases has been increased due to the cluster transmission continuously occurring in the Seoul metropolitan region and others. Next. This graph shows the total number of confirmed cases as well as cases discharged or released from isolation, and the cases in each day since the first case was confirmed. As of 16 July, the total number of confirmed cases is 13,600, including almost 2,000 imported cases, of which 12,300 cases have been discharged from isolation. Newly confirmed cases are 61 in total, including 14 new local cases and 47 new imported cases. Next slide. Since May 6, the number of confirmed cases have been increased, and more local infections are reported. But this week, the trend has been changed. Recently, the number of daily new imported cases is likely to exceed the number of local cases. Next. Previously, most imported cases were from Europe and Americas, but recently the imported cases are mainly from Asia as well as America, Europe, and Africa. Next. For last 2 weeks, almost the half of new cases are imported, and 35% and 8% are local clusters and the context of the previous cases respectively. And just 3% of cases have occurred at hospitals, nursing homes. Next. Now I would like to emphasize how important public health emergency preparedness and response is in the next part. Next. Actually, our efforts for public health emergency preparedness and response has started right after MERS outbreak in 2015 until COVID-19 outbreak. After WHO Korea joint mission on MERS outbreak in 2015, the important recommendations has made. First, early identification and monitoring of all contacts. Second, regular provision of information to the public, including prompt information sharing. And third, strengthening capacity of medical facilities, including training experts for infection control and prevention, as well as laboratory. Next slide. Based on the lessons learned from MERS, KCDC has gone through the reform in its organizational structure and system. We have introduced and established the new infrastructure and systems while expanding and reconstructing our existing health system and public health personnel. Next. These are the measures that we have taken different from MERS outbreak in 2015. We have concentrated on risk assessment and risk communication domestically, as well as internationally, and strengthened the full engagement of local and multi-sector collaboration. Most of all, early detection through rapid testing and active case finding, as well as contact tracing, has been the key approach. Next. This slide shows the timeline, the progress of the situation, and how our government responded to COVID-19. After the cluster cases of unknown pneumonia originated in Wuhan, China, were first reported, we issued alert level 1 and began to prepare for possible importance of COVID-19. The alert level increased to level 2 when the first case was confirmed in Korea, and then to level 3 after more imported cases were confirmed. Secondary transmissions were reported after that. Finally, the alert level was raised to level 4, which is the highest level in response to the big clusters in early February, such as Shincheonji in Daegu and Danam Hospital at the Gyeongbuk province. Next. Again, after 2015 MERS, KCDC established the national laboratory system. We are operating tiered laboratory network from the national to local level that is evenly distributed throughout the country. We also established specimen transporting arrangement within 24 hours for confirmatory testing even before COVID-19. Finally, we have established the emergency use authorization system, which permits temporary use of unapproved in vitro diagnostic devices during infectious disease outbreak. For COVID-19, we used this system for real-time RT-PCR testing kit. Next. It is well known that Korea has conducted extensive lab testing and found cases in early stages. In the beginning of the outbreak, only KCDC is available for laboratory testing, but later on, it expanded very quickly to the Research Institute of Public Health Environment, affiliated with local governments, private medical laboratories, and hospitals till very early February. Therefore, currently, we have a total of 127 testing institutions available, and the average testing capacity is 20,000 per day, and maximum is 30,000 per day. Next. These are pictures of drive-through sample collection and screening clinics. These drive-through clinics has contributed to rapid testing. We also introduced walk-through station and other types for better work. Next. I'd like to point out our contact tracing strategy. There are mainly 4 steps: investigation, risk assessment, contact classification, and contacts management. At the investigation step, we obtain preliminary information through interviewing the patient, primary physician, and family to compensate missing information or confirm the interview outcomes. And then we collect additional information at the stage of risk assessment of the case. Information such as medical records, mobile phone location using GPS, card transaction log, and video footage are collected and investigated in this stage. Based on this information, we classify the close and casual contacts and provide guidelines from movement restriction to symptom monitoring. Next. This timeline shows the various response measures Korea took along with the progress of the outbreak, especially after finding out local transmission, including the Shincheonji cluster, which is the largest cluster in Korea. We tried to consider and conduct appropriate and effective measures for each phase of the outbreak. In response to the increase in case fatality rate as a mitigation strategy, we established a new system to focus more healthcare resources on severe cases. First, we categorize confirmed cases into 4 categories: mild, moderate, severe, and very severe. Each category receives different treatment and gets admitted to different types of facilities accordingly. This was very important in ensuring sustainability of our healthcare system in Daegu City and Gyeongbu Province, where we had big clusters. Next. This slide shows the living and treatment support centers for mild cases. If these mild cases develop severe symptoms, then they would be transferred to hospitals for further treatment. Next. We also further adopted information technology for efficient and creative measures such as the self-help check mobile application, as well as self-quarantine safety and protection application. Next. After the peak of the transmission on February 29, we started recommending the public to practice social distancing. Public compliance to this social distancing campaign was generally very high in Korea. On May 6, we transitioned to a new campaign called a new routine distancing in daily life to advise the public to continue to practice social distancing while pursuing their daily life activities. The campaign advises including staying home if you are sick, keeping a distance of 2 arms lengths between people, washing hands, coughing, sneezing into your sleep, ventilating and disinfecting regularly, and keeping in touch with family and friends while maintaining physical distance. We are trying to help all Korean people integrate these precautions as part of a new daily routine in their lives. We still need to learn more about COVID-19. Till now, we have known that COVID-19 is highly infectious from its early stage and spreads rapidly with cold-like symptoms. New technology is required to enhance our traditional control and response measures, as well as to develop novel measures. Sharing the knowledge and practices each other would be the key to overcome the current global pandemic. Thank you very much.
Thank you, Mr. Won. Thank you for your wonderful presentation. As I mentioned earlier, his presentation was pre-recorded, but he will join the Q&A session that we will have in the later part of this conference. So if you have any question to him, the Director Won, please leave your question on the Zoom chat. So I will pick some of the questions and I'll ask the question to Mr. Director Won. So let's move on to the next speaker, Habib Tomi from Bahrain. Are you there?
Yes, I am.
Okay.
Okay. Hello, everyone. Distinguished ladies and gentlemen, it's a true pleasure to participate in this prestigious conference to discuss global responses to COVID-19 by countries regardless of their size and power. My name is Habib Toumi and I come from Bahrain, a small but beautiful country in the Arabian Gulf. At last year's conference, we paid tribute to all the innocent victims of terrorism. We did not know that in 2020, the worst top enemy would not be terrorism, but a tiny virus that has killed close to 1 million people and affected almost 30 million people across the globe. Such numbers are totally unacceptable. Was the world prepared for COVID-19? No, it was not prepared. Only few countries had prepared responses. The media was not ready to counter the toxic fake news that became as dangerous as the virus itself. The world has often suffered from deadly diseases. Some countries understood that viruses would kill large numbers of people. Others did not. So, how was the global response to COVID-19? Countries that learned lessons worked on reducing the impact of the virus. Countries that did not learn lessons are now paying a high price for their failure. I will mention examples from the best and worst groups in the global response to COVID-19. As the first group, the focus is on safety. This means closing schools, non-essential businesses, and borders, banning events, requiring face masks, telling people to stay at home, and providing answers and solutions. In this group, I will cite the case of Bahrain. Bahrain took the virus seriously and went for advanced preventive measures based on expert opinions, trust, and open communication. Bahrain involved all people in the fight. Everyone was a member of the large team. It used technology for monitoring and tracing cases. Bahrain set up quarantine centers to limit the spread of the virus. The centers were not prisons, and patients enjoyed medical care and facilities to feel at ease. For example, they had 5 meals a day, games, food, and drinks around the clock. Bahrain confronted fake news without complacency. People who circulated fake news were referred to justice for prison or fines or both. Journalists had training sessions on how to work in COVID-19 hospitals and quarantine centers, on how to talk to doctors and patients, and on how to deal with personal pressure. Bahrain launched radio and TV programs in many languages and had street campaigns to reach out to everyone. There was no reported abuse of human rights. Journalists played a major role in the success of the campaigns, thanks to their high sense of responsibility. In this group of successful countries, I can also mention South Korea, Singapore, New Zealand, Vietnam, China, Tunisia, Japan. And you can see this picture from Korea, well explained to us by our friend Peter. Now, in the negative group of global responses to COVID-19, we have a different story, a very sad story. These countries took anti-science approaches driven by political, religious, and economic calculations. They did not listen to expert advice. They failed to protect the weak, the old, and the poor. Political leaders thought they were smart and strong. Religious leaders thought they had divine protection. Economic leaders thought that the economy was much more important, even if the price was many, many deaths. One day, the world will recover from COVID-19. Some countries will celebrate their success, but other countries will have to explain how they failed to understand that with wise policies and true compassion, the health of the people and the health of the economy are not in conflict. Thank you. Wishing you success and health at all times. See you in 2021 with COVID-19 out of our lives.
Thank you for your great presentation information. Thank you, Mr. Habib Toumi. Thank you so much. And let's move on to the next speakers. Chen Yingchun from China.
Thank you, moderator. Hello, everyone. I'm Chen Yingchun from China. It is my great pleasure to meet all of you here. And the world is facing the common economy of the COVID-19 pandemic this year. Since the outbreak of the virus, my China Daily colleagues and I have done a lot of coverage about the coronavirus and its devastating effects on the economy and society. And one of the most touching moments is when one night in May, we found a postcard in China Daily's mail office from a man named Frank Mantova from Bologna of Italy. He mailed a postal card to China Daily on January 29 when China was struggling in the darkest days of its virus outbreak to express heartfelt wishes to the Chinese people. I can speak for my colleagues in relating how heartwarming it was to read the sincere wishes that travels more than 3 months to reach us, and it is also proud that our newspaper has been trusted as a messenger. The COVID-19 has profoundly changed the world and in turn forced the media workers to rethink their role. As the pandemic continues, the media can play an essential role in bringing it to an end. First, we must offer timely, scientific, and accurate information. When Wuhan, then the epicenter of China's outbreak, was locked down in late January, people were in their hometowns spending the cherished Spring Festival with their families. The festive mood evaporated and many people panicked. Chinese media swung into action and sent hundreds of reporters to Wuhan. What followed was a torrent of interviews with people of all levels and round-the-clock reporting of events. Readers and viewers were reached on all manner of platforms, from traditional print formats to screens updating with breaking news, video and vlogs. Interviews with infectious disease experts were instrumental in separating facts from fiction for an anxious public. The message that proved so vital for disease prevention was adopted by people with a collective sense of purpose. Second, I believe that media worldwide should focus more on the lives that have been disrupted. The virus has hit everyone, but so much harder those who have fallen ill, the frontline medical workers, the elderly, the unemployed, and hungry, and the grieving families. And China Daily has launched a column called Behind the Mask, especially to share stories of people around the world, how they survived this pandemic and how they see life after post-pandemic. Third, I wish to suggest that global cooperation is essential. The virus knows no borders, and only when we all join hands can mankind defeat it. That is why it disappoints me when I see news reports that politicize a health and economic crisis, such as the attack on the World Health Organization, as well as efforts to stigmatize the virus. These reports fail to respect the scientific facts and they damage international efforts to defeat COVID-19. As a counterweight to them, responsible media, I think, must promote cooperation and share with the world the anti-epic experiences of some countries. And they should also amplify the calls for coordinated efforts against the virus. So all hands are needed for our joint efforts to take down the common enemy. Thank you.
Thank you so much, Chen Yingchun, for your wonderful presentation. Thank you so much. So let's move on to the next speaker, Katuna Chapika Days from Georgia.
Okay, hello everybody. Let me greet the whole World Journalist Conference 2020. We know it's the online event for the first time. Let me greet all the organizers and the participants. I'm Katuna Chapika, lecturer of politics at San Diego State University, SDSU in San Diego, California, United States, and also associate professor at Georgia Technical University. Let me start with the next slide, please. Okay, is there anyone to move in? Let me just tell something very briefly about the statistics, even though this is the situation which reflects the condition as of September 12, 2020. Practically from the previous week, the number of infected citizens of Georgia increased tremendously. Overall, for the 4.5 million population of Georgia, it's approximately per day 165 people infected from practically for these 3 days, which is a tremendous increase. Next slide, please. Yeah, here we see the very special website being administered by the Georgia government, actually called stopcough.g, which has this information containing, for instance, the how much money is enrolled for the cure and prevention of the disease. This is called Stop Cough Fund, or it also contains the information about the anti-crisis economic plan being implemented by the Georgian government, as well as the, for instance, very useful application for visitors to Georgia, which is a...
Sorry, we have an audio problem.
Yes.
Eric,
could you hear? I hope so.
Yeah, okay, keep speaking.
Okay, next slide, please. Okay, I will be very brief due to the time, especially as I see on the screen. Prime Minister of Georgia, Georgi Gaharian, just even before the very first case was revealed in Georgia, also with the leadership, the medical leadership of the country, and you can actually show the next slide because we have time problem, okay, which is being represented here in this medical leadership. As you can see, these three musketeers called like Pata Ignace, for instance, Deputy Director General of the NSPC, which is National Center for Disease Control, with Tengiz Sertsvadze, head of the Georgian AIDS and Clinical Immunology Research Center, along with Davina Gambian on the right side, who is the head of the NSPC. They took the preventive measures just before the very first case was revealed in Georgia. Next slide, please. Okay, but the fourth musketeers, we can see Marina Zubaya, also from the Clinical Immunology Research Center. Next slide, please. Okay, I will not really go in depth with the developments, but we can see President Salome Zurabishvili, who quite shortly announced the state of emergency and the situation into the breakaway regions like Abkhazia and so-called South Ossetia. We see Kartmani crossing point in the Georgian western region of Imereti to prevent Georgians from entering the breakaway republic of so-called South Ossetia. Next slide, please. Okay, the online classes we simply switched after the third case was already revealed. It was established a state of emergency, and immediately Georgian schools and kindergartens and all the universities switched to the online and distance learning. Next slide, please. Irakuchikovani just announcing the state and the measures and recommendations for the citizens of Georgia. Please, next slide. And okay.
So it's not actually now. Its time is up. So if I give you 10 seconds, so please give your
yes.
keynote.
Please, yes. Please go to the last slide then. Okay. Okay. No. Last slide, please. One moment. Last slide, please. Next one. Okay, Georgia is being considered as one of the most practically successful examples so far dealing with COVID-19 through very complex disease control methods, but also preventive approaches, which was implemented by the healthcare professionals. But first of all, I can say political leadership, which makes them very popular actually in the country to deal with COVID-19. It has lifted the country in a state of emergency as of May 23, but there are other restrictions, as I've mentioned, with the increase, especially right now in the country. And so we have, we already switched to distance, for instance, teaching and learning, and some restrictions in the public gatherings. All of the public ceremonies are cancelled, and it became really, really harsh right now. So the professionals will work hard to control the whole situation. Thank you. We have very short time, but thanks.
Okay, thank you so much, Katrina Chapikadze from Georgia. As I mentioned, with time we have is quite limited, so please keep in mind to get your present done within 4 minutes. If you go beyond that, I can cut it short. Please keep in mind. Let's move on to the next speaker, so who is Hassan Humeida from Germany. Are you there? Mr. Hassan? Please press unmute button to speak. Can you say anything to check if you are on the line? Mr. Hassan Humeida. So I think we have some technical problem with the Hassan Humeida. So we will move to the next speaker. Ready? Next speaker, Nilima Messer from India. So we will check first check the technical problem with the Hassan Humeida, and I will push him back to the later part of the presentation session. So let's move on to the Nilima Messer from India. Yes, you can speak now.
Okay, good day to everybody. It's an honor to speak at the 2020 WCJ and be with all the participants in this virtual experience, which is proving to be very interesting. So I will be speaking about COVID-19 in India. The vigilance since India reported its first case of COVID in January 2020 cut across every sector from health to industry to the plight of migrants. Responses developed on a daily basis on the basis of analysis, evidence, and long-term planning. India is stated to be the country with the third largest number of COVID-19 cases in the world. This figure needs to be perceived in context of its population number. As per today, the number of cases in India is nearly 5 million, but in a population of over 1.3 billion. In comparison, over 3.8 million have recovered, and the reported figures of death are about 80,000. There are about 30 COVID cases per 100,000 people in India. 30 per 100,000. This is considered the lowest and must be viewed in context of the population density of this country. The global average of cases per 100,000 is 3 times higher than that of India. There are other factors that are unique and noteworthy in context of COVID-19 status in India. India as a whole is a complex whole of diversity. Language, religion, custom, food habits, dress codes. In effect, India is really not a country but a subcontinent with 28 states and 8 union territories. Health is a state subject in India, and each state can choose its own path. The COVID-19 crisis showed that the central and state governments need to work cooperatively to fight the battle in spite of their politics. This has been a unique experience in independent India. India's health credentials, unfortunately, are a mixed bag of dichotomies. Infant and maternal mortality rates and related matters of poverty, hunger, there is such a lot to be said in each of these cases. Pitted against this are India's achievements in eradicating smallpox and polio and reversing and stemming the HIV/AIDS spread. This too in a country where illiteracy still stood at almost 25%, and that was nearly 35% in rural India. How can such complicated health-related achievements be attained in such a large illiterate society? In 1975, New York Times correspondent stated that eradicating smallpox from the globe is a fantastic achievement and the greatest achievement by India. In 2014, India was declared polio-free after no cases were reported for 3 consecutive years. According to World Health Organization, this was one of the biggest achievements in global health. India has the 3rd largest HIV epidemic in the world. Even so, India's HIV epidemic slowed with a 57% decline in new HIV infections in a 1-decade period. These case studies are as much an example of India's resilient capacity as of the character of rural India. The rural Indian is actually the common man of Bertolt Brecht, with sensibilities and intuitiveness that guides their decision-making process in their own best interest. Until May 2020, 216 of the 739 districts of India...
The time is up, so please, I'll give you 10 seconds. Please wrap it up in 10 seconds.
Oh my God, okay. The COVID migrants who underwent an inhuman experience belong to and went to rural India. The rural population forms over 68%. Will Corona teach us to develop a post-Corona paradigm of growth for this population that works on the ground? Thank you.
Thank you so much, Nilima Mesa from India. Before moving on to the next speaker, I have a reminder for you. If you have any question regarding the presentation, please leave your message on Zoom chat. Also, now I look up the message you left, and some of the message you left that has no person you are asking the question to. So please designate the presenter you want to ask a question, okay? So I'm now seeing some of the questions that have no person or presenter you are casting a question to. So please designate the presenter you want to ask a question. So anyway, thank you all for your participation. And let's move on to the next speaker, Haim Iserovich from Israel.
Hi everyone, can you hear me? Okay.
Yeah, I will find.
Hi everyone, I'm happy to be here. Thank you for the honor to be here. I still have a good memory from my last visit to South Korea 2 years ago, and I hope next year we'll all meet in person again. I would like to speak about Israel. We have the unflattering honor to be the first country in the world to reimpose a lockdown from this coming Friday for 3 weeks because we failed. We failed in the fight the coronavirus pandemic. The first wave, we were one of the successful countries in the world. Low mortality, low infection rate, but there were a lot of reasons why we failed. Politics, no strategy. I'd be happy to speak about it later on during the Q&A session. But the pandemic hurt us all in Israel, like all over the world, but in Israel we have a huge economic loss, and we sacrificed a lot. In April there was a Passover Seder, one of the holiest night for the Jewish people, and we have to do it like now, through the Zoom application, not meeting our families. And this coming weekend is the start of the Jewish New Year, and again we have to do it from afar from our dearest relatives. In my short time, I would like to mention a few notes about the media during the pandemic. First of all, the media need to do reporting and explaining to the citizen, to the public, what is going on, what are the rules, what's happening with the pandemic, what new research and everything. The second one, I think, not relevant, is the complete transparency. Since the government are elected by the public, by the people, the media needs to demand, in the name of the people, full accountability from our leaders. And this is one of the most important roles of the media. And the third one is bringing the personal dimension, bring the stories of the sick people, of unfortunately the people who died, names, stories, and because we have economic crisis, so bring the stories of all the businesses that suffer from the crisis. It's giving a much more personal dimension to this crisis. It's not that they're sick, they're close. It's eventually you can meet someone, and in Israel, which is a small country, you always know someone that is sick, his business was hurt, is unemployed, is in isolation like I am right now, And for summarize the bottom line, in every crisis, especially in this kind of 1 in 100 years crisis, the media has an important and crucial role in reporting, explaining and demanding full accountability in the name of the public. But it's also need to remember not to exaggerate the real picture or give space to spreaders of fake facts.
Excuse me, the time is up, so give you 10 seconds.
Yeah,
10
even
seconds.
less.
Yeah.
But to present the public with the most updated, complete, and reliable information. Thank you very much.
Thank you for your wonderful presentation, Mr. Moscatello Antonio from Italy. Let's move on to the next speaker, Norella Mohud Daoud from. This one? Sorry. This time the speaker is Moscatello Antonio from Italy.
Hello everyone. I'm glad to take part in this World Journalist Conference online. Italy was among the first countries in the world after China and Korea to be attacked by COVID, and we had, in my opinion, some good response, but also many mistakes by government and health authorities. I will focus on mistakes in order to understand and don't repeat them. There are studies saying the COVID-19 spread in the Lombardy region, the most affected area in the north of Italy, between November and December of 2019. Italian health and government authorities were late in understanding the danger of the disease. In January 17th, the EU held an emergency meeting, but Italy was not there. Italian government showed signs of concern just at the end of January, when a couple of Chinese tourists were isolated in Rome. From that day, the flights from China were stopped. That was not enough. Until the last week of February, many European countries sent a large quantity of PPE, protective masks and so on, to China. But they didn't have protective equipment for themselves. Italy had no stock of PPE. And for many weeks, we had a deep lack of these equipments crucial for the fight against coronavirus. Another big mistake was the lack of leadership among the officials who had to isolate as soon as possible the most affected area in the country. Lombardy region is the industrial core of the country. In the second half of February, big clusters arose in this region. Neither central government nor the regional government sealed off the affected areas with due promptness. Furthermore, the central and regional authorities argued between them. In consequence of these mistakes, in the first half of March, the central government had to close in a tight lockdown the whole country with devastating economic losses. In Italy, the health system is organized on regional basis. There are 20 regions and 20 autonomous health systems. In the framework of rules given from Rome, different regions adopted different approaches to fight COVID-19. In this panoply of rules, some deadly mistakes were made. For example, Lombardy region decided to shelter people with weak symptoms inside the residences for elders. So, if the performance of public authorities in Italy were so poor, why is the country now seeming more resilient to the second wave than other better organized countries as France, as Germany? In my opinion, the answer is because of the people. Generally speaking, in Italy there is a lack of trust in authorities, but in the months of lockdown from March to May, Italians adhered very strictly to the tight rules from the government.
Sorry for interrupting your presentation. The time is up, so please wrap it up in 10 seconds, please.
Okay, right to the conclusion. They adopted the social distancing, and many months later, they are still respecting that to some extent. Thank you.
Thank you very much, Moscatello Antonio from Italy. Thank you for your wonderful presentation. Let's move on to the next speaker, Noella Mode Daud from Malaysia.
Hello.
Yes, fine.
Can you hear me?
Yes,
Yes.
everything okay.
Yes. I would like to start my small presentation with the latest COVID-19 cases in Malaysia. We have about 30 over million population in Malaysia, and as of yesterday's situation, we have 9,203 cases. There is about recovered. There is about 92.5% of the total cases. Right now is 9,946, and the active cases are 615, and they have been isolated and under treatment. And 11 COVID-19 cases were admitted to the intensive care unit, where 5 of them need respiratory aids. As for yesterday, there's no death case, and the cumulative total remain at 128. So I would like to respond in a very objective manner, where because of this really objective step that the government has taken, that we managed to contain the COVID-19 cases as compared to our neighboring countries. As we were very shocked at that time, the nation had a change of government. It's from the Pakatan Harapan to Perikatan Nasional. And amidst of the pandemic, we were being surprised and get shocked because of the new government taking over. But luckily, everybody was quite in a good mood and discipline, and for fearing the COVID-19 pandemic. So it looks like the Malaysians are very obedient, and there's a little cases of non-compliance. But until today, there are still many cases of non-compliance of the movement control order. We have actually 3 steps or 3 kind of control order. First is the movement control order that was very strict. Nobody can come out of the house except one person or the leader of the family to buy essentials, and most of the public services were closed, and everything was quite very funny. It's a new norm for us. And the worst thing is that at that time we were having 2020 was the Visit Malaysia year, and so many tourists have been in Malaysia, and we have to strike the Visit Malaysia year, and we have lost the target of 30 million visitor arrivals and the income of 100 million. So, but still the life must go on, and the government has been very brave to impose the movement control order from March 18 to March 31st, and after that they observe the situation of the COVID-19. They have changed to conditional movement order, control order, that is only emergency cases or medical purposes that you can cross the border, especially when the red zone people cannot cross over the green zone. And it comes to the recovery movement control order, that is the government is balancing the economy and the COVID-19. And now the recovery movement control order has been to be extended to December 31st.
Our time is up, so please wrap up your presentation in 10 seconds.
But we have also been very fierce for our Prevention and Control Infection Disease Act 1988 or Act 342, where a person not complying to the standard operating procedure will be compounded and go to jail or both. But,
okay, thank you. Time is up, so we need to cut your presentation short. Yeah, so thank you so much. Nola Modu Daudu from Malaysia. Let's move on to the next speaker, who is Cooper Charles from Nepal. Are you there?
Namaste from Nepal. I think you can hear me. The COVID-19 pandemic has shattered the global order of nations and also the humankind. Since the COVID-19 has been a global pandemic, it called for a global response action, but in the beginning, only a few countries were very much active and others thought it might not impact them. Almost all the countries across the globe went on for the lockdown, making the earth come to standstill, of course, breathing the economy as well. In Nepal, we had the first case in the late March. And when we saw the first case, when we detected the first case, the government started lockdown on March 24th, and which continued till 120 days. That means 4 months within the whole economy. The schools are still not open. The educational institutions, almost all of them. The flights are not open, the domestic flights. We are going to open from maybe, most probably from next week. The newspapers, so most of the newspapers went on doing their digital version except for the print copies. We also at Harvard, where I work, where I am the editor, stopped for 15 days, 2 weeks, the print copy, but we went on doing our digital content and everything. Then again we started working and work from home and all this. At present, the death rate, the number of deaths has increased more than 300. It's the population of Nepal is 30 million, so 300 plus death means it's not very low and it's not very high either. Infected, number of infected is 5,000. Daily it's around 15 deaths we are encountering. Actually, we are seeing the late impact of the COVID. Most of the countries have come out of the first phase and second and third wave. Now we are, I think, at the peak of the first phase. So flights are not going to open till now. The jobs are lost. Out of every 5 people, 3 people lost their job. Economy, I think, is going to be in negative. The GDP is going to record the negative this year. Global economy has shrunk. That's why its impact is on Nepal's remittance. Overall, South Asia's remittance has gone down. And the most important thing is the good examples of the Korean and Singaporean governments. We couldn't pick up like most of other countries' governments. Our government's mishandling also created this problem. Though they have tried to do something, they come up with regular bulletin and the information, but most of the times the information are authenticated or not. That's the most important part. And as a journalist, we who are supposed to give the authentic information are at the back seat most of the time because we don't know. Everyone is trying to be the expert here. Even WHO and everything there is counter conspiracy theories and all these things. But out of all this, I think there are some good points. This pandemic has taught the human beings to spend more in health, education and youth and work together. The whole world should work together because this positive synergy can help fight this such kind of global pandemic tomorrow also. And the other thing is the global pandemic has forced us to go digital actually. The new normal is supposed to create a faceless system where we can work with less corruption maybe because there will be faceless system. So I think in conclusion, there are many bad things because loss of human life, loss of property, loss of this thing is bad. But still, learning from this pandemic, we think we can have better world post COVID, and may we meet in person in next WJC 2021. Thank you.
Okay, thank you so much. Thank you for your wonderful presentation, Cooper Charles from Nepal. So let's move on to the next speaker, Abuka Ibrahim from Nigeria.
Hello, good morning. Yeah, I hope you can hear me.
Yes, fine, everything's fine.
Perfect. So the moment COVID-19 became a global pandemic, Nigeria deactivated its viral disease protocol, which was put in place in 2014 to combat the outbreak in the country that year. As early as February, all passengers flying into Nigeria were screened at airports for symptoms of COVID-19, when such screenings were not done in countries such as the US and the UK and other countries of the world. On February 27, an index case was discovered by an Italian traveler to Nigeria. And in the 7 months since, cases have risen to over 56,000 now, and a little over 1,000 deaths, 1,083 to be precise. We actually all feared that it would be worse. Nigeria has always had a poor healthcare system which has suffered years of neglect. Billions were raised in donations by corporate Nigeria, business moguls, and donor agencies to help build isolation centers across the country, to procure PPE and ventilators as well. These centers went up quickly in the two major cities of Lagos and Abuja. Other cities followed. The National Center for Disease Control, NCDC, expanded its call centers to monitor persons of interest, meaning those returning from foreign trips. These are challenging times for Nigeria and for the rest of the world. They are even more interesting times for journalists. There's a lot of money invested in the fight, and considering the government's reputation for mismanaging funds, journalists have to keep an eye on the spread of the virus and the disappearance of the funds into private pockets. It is a tricky balancing act to pull off, especially considering that with the lockdown and the attendant economic impact, media houses were forced to cut down their workforce, cut wages, and ordered the majority of their staff to work from home, if possible. The few journalists on the front lines have to contend with news stories on the spread of the virus, the human impact, and the economic woes, and how government is managing the finances to fight the virus. As expected, it didn't take long for discrepancies in the accounting to emerge. The amount budgeted for treatment and care of each individual case in most states is not in any way consistent with reality or the care that these patients receive. In the northern state of Kano, for instance, where the governor had been caught on tape taking graft before, the state went about without any precaution or social distancing, and once an index case was recorded, cases rose from 0 to 60 in no time. It soon became clear that the daily increase in confirmed cases in the state is not commensurate with testing capacity. The state government was doctoring the figures because they want to receive money from the federal government. The moment they got this money, the number of confirmed cases fell drastically, and the lockdown in the state was eased. In several other states, similar discrepancies became apparent in the number of confirmed cases and the finances around the pandemic. In the coming weeks and months, when this pandemic is over, journalists will have a field day auditing the accounts and figuring out exactly how money is spent to fight COVID-19 was spent. Thank you very much.
Thank you for your presentation, Mr. Abuka Ibrahim from Nigeria. Next, move on to the next speaker, Raul Aijazu from Pakistan. His presentation was pre-recorded.
Hi everyone, I am Rahul Ajaz and I'm a writer, filmmaker and journalist based in Pakistan. First of all, thank you for having me on this platform. Today I would like to speak to you about Pakistan's response to COVID-19 and its disease control methods. I would say Pakistan's example is that of a college student procrastinating until the day of assignment and still managing to finish it. We had a similar response to COVID-19. While the world took it seriously from day one, we waited until March to realize the potential threat it posed. Early on, Pakistan Prime Minister Imran Khan believed coronavirus was only a flu and people need not be worried. Then he would impose a lockdown and then change his mind again and again and again. The government established the National Command and Operations Center to monitor COVID-19 response, and with the lockdown imposed by mid-March, Pakistan had around 6,000 active cases by the end of the month. But the numbers have skyrocketed from April onwards. People didn't believe in coronavirus, didn't follow the SOPs. The clergy saw it as an attack on Islam, preventing Muslims from shaking hands and praying in mosques. And then religious festivities such as Eid al-Fitr happened. All this further spread the virus. This virus will spread more, the Prime Minister had said in his address. I have to say with regret that there will be more deaths, but Pakistan could not afford to remain shut any longer. He had argued, and people will have to learn to live with the virus, and that they could not feed the poor indefinitely. And then Pakistan reported the single highest day increases since the outbreak on June 13th and 19th. A study conducted by the Imperial College of London predicted Pakistan could have up to 2.2 million cases by the end of the month, which is June. So the World Health Organization had to write a letter to all provincial governments to, refrain them from lifting of the lockdown. The predicted doomsday almost happened when on July 1 we had over 1 lakh active cases. But then the numbers suddenly started to decline. It was a miracle. We have had no more than 9,000 active cases by mid to late August. Recoveries have been higher and hospitals aren't pushed to their limits anymore. Until August 29, Pakistan has conducted around 2.6 million coronavirus tests, has had nearly 300,000 active total cases and 6,284 deaths. And while it can be said for sure that there have been many unreported and unregistered COVID-19 deaths, the numbers can't be much higher or even in the predicted range. But how did it happen? A lot of Pakistani Muslims believe the virus would only affect non-Muslims, but it definitely isn't that. Around 100 countries have fared better than Pakistan in terms of total number of cases as well as fatality rates. So we aren't really as blessed as we initially thought. Media also played an interesting role in scaring people into compliance, to becoming less aggressive lately. It was rather social media where horrifying personal stories came to light and left people confused whether all of this was real or not. Conspiracy theories were also born from the same fabric of fake news and confusion. Now, unsurprisingly, people believe we have defeated COVID. Yes, Pakistan is recovering, but it would be too early to celebrate victory until the virus is completely eliminated. The country has reopened to a degree, but winter is coming. And with that, we don't know what to expect. The best possible way is to continue following precautions, maintain social distancing, and tackle it one day at a time. Thank you.
Thank you for your presentation. Let's move on to the next speaker, who is Gracie Maria Kenneth from Papua New Guinea. Are you there?
Hi.
Yes, fine. Everything perfect.
Yes. Thank you very much. Papua New Guinea is hello everyone. Papua New Guinea is celebrating Independence Day starting today. We are turning 45 years old. But anyway, I'm going to present my presentation will be on the global pandemic response, the global response to the pandemic. I am with a newspaper that's the #1 newspaper in Papua New Guinea. It's the oldest, about 50 years old, but it is not a state but private company newspaper, one of the 2 dailies. Now, COVID-19 in Papua New Guinea is, especially in a country, Papua New Guinea has a 10 million population with 850 languages, 1,000 tribes, and the way it's a developing nation that found it a little bit weird in addressing COVID, because the symptoms of COVID was actually like malaria. Malaria is, Papua New Guinea is prone or known to be a malaria-infested country, which the symptoms are similar to COVID-19. Now, the World Health Organization found it a little bit uneasy, a little bit tough addressing COVID-19 in Papua New Guinea because of the geography of the country. It's very hard. It's not an easy task for this, especially when 85% of the population is based in rural areas, and about 15% is modernized. That's the reason why I think I had a lot of problems with the telecommunication system here in the city. I live and work in the capital city of Port Moresby. I had to leave my office, so I come to my house so I can go online. Countries like Korea, America, Australia, the world over, assisted Papua New Guinea because we are a developing nation. They assisted through World Health Organization in addressing the COVID-19 here in the country. We've got about 6 deaths, about only 25,000 population tested out of the 10 million. Most of them came in through the borders. We share the border with Indonesia and Australia and the Pacific. We are in the Pacific, that's why it was a little bit hard. But the good thing, the positive aspect of Papua New Guinea not really affected by the COVID-19 is the fact that it's not a law, but every child that is born is immunized. They have to go through 1 year of immunization. There's a 1 year, 12 months of immunization. Every month we get injection, and that's why when COVID hit Papua New Guinea through the borders, we were not really affected. But that's just how we were positively addressing this issue. Now, the media also played a big part. Of course, fake news connected to the fake news. Fake news caused a lot of mishap in the country. It actually really affected our government system as well. We've got a pandemic controller. It's called the pandemic controller. This COVID-19 is now, we've got a prime minister, but we also have a pandemic controller. And the pandemic controller is our police commissioner, and the deputy is the health secretary.
Sorry for interrupting your presentation. The time is up, so I give you 10 seconds.
COVID-19 operations here in Papua New Guinea.
Just to wrap it up your presentation in 10 seconds.
Health organization and countries like Korea, South Korea, Australia, America, Europe.
Excuse me.
Yes.
Can you hear? I'll give you 10 seconds because the time you are allowed to speak is over. So please wrap it up in 10 seconds.
Yes. Okay. But anyway, I thought that Papua New Guinea was going to be lucky, but we were not lucky. We're just not so lucky like other countries in the Pacific. But we're still lucky because of the fact that we've maintained and addressed COVID-19 throughout the whole year, since January.
Okay, thank you so much, Goresi Maria Penes from Papua New Guinea. So before moving on to the next speaker, as a reminder, if you have any questions regarding the presentation, please leave your message on Zoom chat. And when you leave your questions, please designate this presenter you want to give a question to. Now I'm looking at the chat room, and I see some of the great questions you are giving to people, presenters we have now who give their presentation or now waiting for their turn. Anyway, when you leave a question, please designate presenter you want to ask a question. Okay, so let's move on to the next speaker, Ivan Rim from Singapore.
Hello.
Yeah.
Singapore's response to the COVID virus is one of a success story in the beginning that turned sour midway, and that led to a lot of a real battle, bring back government control. Now, like any other countries, we are fully prepared thanks to a stable government and the good public administration were able to set in motion timely measures like setting up a task force headed by ministers to tackle the crisis. And this is, of course, based on our past experience of contesting the SARS outbreak in 2003. And the standard operating procedure, like done in many countries, also includes a alert system where citizens are able to tell publicly how the virus has progressed in the communities. This is a color-coded alert risk assessment system where people are told that the virus is spreading fast and therefore we have to take more restrictive actions. Now the government, of course, follows standard operating procedure in the beginning, and the first line of defense was at the border, the control at the airport, where owing to our close ties with Wuhan in China, there are a lot of tourists, travelers, businessmen who come to Singapore from China, and then we could not shut them out, partly because of close cultural, social relations as well as economic relations. At the same time, this is also the Chinese New Year period. As you may be aware, the Lunar New Year was coming on January the 25th. And therefore, there's a great deal of travelers coming to Singapore, and we could not shut them off, unlike America, where the first line of defense was to shut the borders for travelers from infected countries. So the problem when we face allowing the travelers to come in is how to stop the virus from infecting the local population. And the measures taken were to have temperature screening at the airport. And those travelers were found to have with nursing or fever would have to be isolated and sent to the hospital for further checks and treatment. That's the first line of defense. And then those who return from China, Singaporeans and workers who are found to have the fever would have to be isolated for 14 days, a kind of a quarantine or stay-at-home requirements. So in the process, we were able to put the lid on a lot of infections from overseas. But even then, there are slips, and we allow Chinese travelers to come in. Some of them were attending business conferences, some of them attending churches in Singapore. And the first cluster of Chinese outbreak was in the church, where the worshipper somehow spread the disease to Singaporeans. And once a local infection took place, the government then activated more stringent actions like declared a DOSCOM alert system from yellow to a higher level, orange. And that in the process led to more restrictions. Mass activities were stopped. Schools were asked to close and to return to online learning. Now, the problem in Singapore is that the government is also exploiting the opportunity in the crisis.
Excuse me, the time is up, so please wrap up your presentation in 10 seconds.
The government's action to hold an election during the COVID crisis was because it wanted to win the credits from its handling of the virus crisis and so win support. But in the process, it overlooked the mass infections in the dormitories where foreign workers were staying. And we have up to more than 500,000 foreign workers from Bangladesh, India, and the other countries who are working and staying in dormitories where there is exponential transmission.
Okay, thank you, Ivan Rim, because we have a limited time for the presentation. So thank you so much. Let's move on to the next speaker, Khadar Al Ismail from Somalia.
Can you hear me?
Yes, perfect.
Yes. Thank you, Mr. Moderator. It is my great pleasure to attend this important conference. I would like to appreciate the largest organization of professional journalists in Korea and its leadership. You really deserve acknowledgement for the effort you put into organizing this important conference during the world is facing very critical situation by COVID-19 pandemic. I wish all journalists around the world...
Excuse me, could you speak a little bit slowly because the translators are difficult to catch your speaking.
Before the topic on impact of COVID-19 on journalism, I would like to brief the conference the conditions of journalists and journalism in Somalia in general. Journalists in Somalia continue to face difficult situation and permanent problems. Still, Somalia is one of the most dangerous countries for journalists in Africa. At least 8 journalists have been killed since 2017. The National Union of Somali Journalists, NUSOJ's latest annual report also stated excellent of attacks against journalists and news media organizations. Killings, intimidation, and arbitrary arrest are regular harassment to journalists in Somalia for the last 3 decades. The violation against from all power sides. The impact of COVID-19 on Somali journalism and journalists. As in many countries in the world, also Somalia is authority, but federal government of Somalia and federal member states are increasing politicizing of the pandemic and effort to blame its effect on political opponents have led to threats, arrest, and smear campaign against journalists who maintain fact-based information about the spread of COVID-19 and the advocacy of measures to prevent it. Access to state-held information about the coronavirus crisis was more and more difficult and closely controlled in Somalia. In Mogadishu, Federalist Ministry of Health set the tone on 3 March, when it summoned journalists to explain what to do and not to do during COVID-19 crisis. The ministry told them that COVID-19 related information could only be obtained from the Deputy Minister and Coronavirus Task Force spokesperson. But reporters have found it difficult in getting information they need from these sources. At the same time, NUSOJ have established that other relevant sources that have been told not to talk to journalists. This means that journalists were being unable to report vital information to the public or have been forced to use pre-recorded video clips and statements prepared by the Ministry of Health. Somali journalists have been also among the most vulnerable people to the COVID-19. NUSOJ has registered more than 15 journalists after testing positive for COVID-19. As a NUSOJ, we published new guidance advices setting out how journalists and media houses in Somalia can meet their media duties as they navigate the effect of coronavirus. To improve the safety and protection of media and journalists from the ongoing risks, we distributed protection materials. As a NUSOJ, we provided personal protection equipment PPE in July, June, and August to more than 500 of our members operational all over the regions of the Somalia, especially reporters and technical individuals. The purchased personal protection equipment is PPE consisting of face mask, hand sanitizer, and gloves were intended to be distributed to the journalists working for most dangerous regions to ensure their protection from the pandemic coronavirus disease. Finally, the National Union of Somali Journalists, NUSOJ, reminds journalists across the country...
The time is up, so could you wrap up your presentation in 10 seconds?
To maintain professional and responsible reporting ahead of upcoming regional and national elections to the country and this pandemic period. Thank you.
Thank you so much, Kadar Al Ismail from Somalia. I think it's a message for all the presenters. Now we're waiting for their turn. Time management is quite important, but you don't need to speak so much because the translator find it difficult to catch up with your presentation. The reason why actually I'm speaking this is to give time for the presenter who is now quite exhausted, I think. So let's move on to the next speaker. Is Ashiak Mozen Nazi Al Atori from United Arab Emirates.
Hi, nice to meet you all, everyone. My name is Ashwa, and I'm a Arabic reporter, and I was a correspondent in South Korea from the for Corona on February till June. However, I'm going to talk about UAE. The spread of the novel coronavirus COVID-19 in UAE started in March 2020. The government have done tremendous efforts to contain the spread and maintain continuity of business and education. By today, UAE has conducted a total of 8,191,501 tests with an average of 67,000 tests per day, one of the highest per capita testing rates in the world. UAE, following also the steps of South Korea government of rapid-wide testing, has provided drive-through national screening centers for COVID-19 across all the Emirates. We have 7 Emirates. On 14th of July, Ministry of Health and Prevention introduced the laser-based DPI technology to detect COVID-19 cases. The DPI technology is based on laser, using blood samples for examining the virus. It allows the health authorities to carry out a large-scale screening with a few seconds, serving as the first step to detect suspected cases of infection before they undergo the PCR swab test. It's user-friendly, non-invasive, and no cost. Starting with the basic prevention, wearing masks in UAE is a mandatory for all in public places, public transportation, commercial centers, indoor and outdoor. International flights services were discontinued in mid of March and start to be resumed starting from July 2020 gradually. The UAE launched also the National Home Testing Program for people of determination for citizens and residents to ensure all segments of the community have adequate access to testing facilities, especially for those who are unable to move normally or have difficulty communicating with others. In end of April, Dubai Corporation for Ambulance Service announced the launch of Mobile Laboratory Unit, MLU, as part of initiative to provide free testing for the elderly and people of determination at their homes. In line with the efforts to contain the spread of the new coronavirus, in March 2020, Ministry of Education started educating students of schools and higher education students through distance learning. This month, which is the start of the new academic year, schools reopened with adopting the new prevention regulations, such as minimizing the students' number and giving the option of distance learning. Also, prayers were temporarily suspended in all places of worship across the nation from 16th of March. It was resumed also recently with also following the regulation of social distancing. The federal and local government, the UAE, adopted a remote working system in a bid to ensure the health and safety of its employees and customers. We're still working till this day, week by week, for some of the companies, and the company has the freedom to do so. National media councils had decided to stop temporarily the distribution of all print, newspaper, magazines, and marketing materials with effective from 21st of March 2020. UAE government have decided to close all commercial centers, shopping malls, along with other stuff during the program that has initiated, which is the National Disinfection Program. I think my test is coming to end. UAE became one of the first few nations to go ahead with human trials and reach phase 3 of testing of vaccine of COVID-19. The first phase 3 trials of an activated vaccine for COVID-19 in the United Arab Emirates are coming the largest in the world on volunteer recruitment, having reached 31,000 vaccinated volunteers from more than 120 nationalities in only 6 weeks. Also yesterday has issued emergency approval for the use of COVID-19 vaccine currently in its third phase testing. The vaccine will only be available for the first line of defense, who are the highest risk of contracting the virus. The vaccine
time is up. Please wrap up your presentation in 10 seconds.
Yes, sure. The vaccine is fully, completely compatible with the laws and regulation. UAE post-COVID-19 strategy is reviewing the government structure and size and currently may merge ministries to make way for more flexible and speedy government as part of its strategy to deal with the effects of the COVID-19 pandemic. And there are six main areas to focus on, which is health, education, economy, food security, society, and government. So that's for the future of after COVID-19 and other emergency cases in UAE. Thank you so much.
Thank you so much, Ashak Mohsen Naziar Atoro from United Arab Emirates. Now seeing the chairwoman, I find many wonderful questions you left on the chat room, but some of them left a question about fake news. But actually, this is a topic we discussed yesterday, so we don't want to divert the attention to the issue that is not covered by today's event. We need to focus on today's topic, which is COVID-19 and its global response. So keep in mind that fake news is an issue we discussed yesterday. So we need to concentrate our discussion on the today's topic, which is COVID-19 and global response to the pandemic. So please keep in mind. So let's move on to next speaker, Dilmurod Jumabevu from Uzbekistan.
Hello.
Yes, fine.
Hello. You hear me?
Yeah. Just speak.
Okay. Okay, thank you very much. First of all, let me greet all my colleagues from Uzbekistan on behalf of Uzbek media. So, if to talk about COVID-19 in Uzbekistan, COVID first reached Uzbekistan on March 15. Today, after 6 months, the country with population of 36 million people could manage to keep its cases around 50,000 people, to be exact 48,000 for today, and the recovery rate reached 95% in Uzbekistan. It's important to note here that many of these 48,000 people are those who are citizens brought from abroad, who found themselves in abroad in the beginning of pandemic. I should emphasize that from the first day of the pandemic, Uzbekistan is providing free testing and free treatment opportunities for all. So to create additional infrastructure for fighting against coronavirus, 10,000 bed infectious disease hospital outside of the capital of Tashkent and same hospitals in all 12 regions of the country has been built in Uzbekistan. A large number of medical equipments have been bought abroad. Also, medical workers who work in such quarantine hospitals are being given extra salaries. For example, $2,500 for doctors and $1,500 for nurses. From the first day of pandemic, Uzbekistan shut down all schools and universities, and till the end of academic year, on national TV channels, online video lessons have been gone on. So, what else? To fight against coronavirus, Uzbekistan invited specialists from Russia, Turkey, China, Germany, and South Korea, and they shared their experience treating COVID-19. In coronavirus situation, in pandemic situation, Uzbekistan effectively solved two important problems. First, protecting the health of life of people, at the same time to deal with economy, delivering conditions for all to work and at the same time earn for living. So different measures were taken by government to support domestic business, including immediate setup of anti-crisis fund of $1 billion. Of course, there were great challenges for its economy and social sphere for the country, but Uzbekistan is living with the motto, not a single person, not a single family in the country should be left without the attention and care of state in society during this pandemic. So to support people with the initiative of the president, there was created national movement, kindness and support, and all entrepreneurs helped people who needy families and temporary unemployed people with financial assistance, food and medicine. And in its turn, the state is providing for these entrepreneurs different various taxes, leasing, loan benefits, and preferences, as well as access to different necessary resources. So, from the first day of September, Uzbekistan is step by step starts to ease lockdown measures, allowing all business to reopen from September 5 with sanitary rules.
Time is up, so please wrap up your presentation in 10 seconds, please.
Okay, Uzbekistan, there are defined rules for each type of activity with the frame of sanitary requirements. Just yesterday, schools have started a new school year. Uzbek business also has become adapted to pandemic situation. In short, to conclude, I can say that Uzbekistan has learned to live and work the pandemic with iron discipline. Thank you very much.
Thank you, Mr. Dilmunrolu Jumavevu from Uzbekistan. Thank you for your wonderful presentation. I have a final notice for you. If you have any questions regarding the presentation, please leave a message on Zoom chat. And also when you leave your question, please designate the presenter you want to ask a question. And now we have selected some good questions that I will ask later on. Many of them are for Director Chun Jun-woo, and then there are some others for other presenters elsewhere. So this is a final notice anyway, so if you have any question, leave your question on the chat room with the name and nationality of the presenter you want to ask a question. So let's move on to next speaker, Lan Chu from Vietnam.
Good afternoon.
Yeah.
Good afternoon, everyone. I am Lan from Vietnam. Can you hear me clearly?
Yes, perfect.
Yeah, it's my great honor to join you at the conference today, and I would like to share with you about the virus fight in Vietnam. As you may have known, Vietnam has been praised by international friends for our first success in combating coronavirus. There are different factors that contribute to our success. Today I'm going to explain the three most important factors. The first one is about prevention work. So far, Vietnam has gone through two main virus outbreaks. The first one occurred in January, and we contained it in less than 2 months with just over 200 infection cases and no death. After that, we had enjoyed over 3 months without reporting any case until the second outbreak occurred in late July. But with experience learned from the SARS epidemic in 2003, Vietnam was determined to carry out very tight prevention work. We know we have limited healthcare resources, so Vietnamese authorities encourage the local people to follow tight measures to avoid the large number of infections. And we believe that we can curb the new outbreak soon following a call from local doctors. Prevention is always better than cure. And the second factor is the joining of the military force. In Vietnam, coronavirus is called an enemy, and so many forces have been mobilized to fight against it, including the army. The military staff have helped in setting up checkpoints at border gates, building makeshift hospitals, and arranging quarantine activities. And the third important factor is the role of the media. Amid rising fake news about COVID-19 pandemic, the media agencies in Vietnam have helped explain the true situation and gather support from the public in the virus combat. Besides, local journalists also write about the work of various forces involved in the fight, from medical workers to the police, the army, and volunteers. By their stories, the media have spread the message on human compassion and mutual support from the community during this difficult time. Briefly, these are the three main factors that are helping Vietnam win against coronavirus. And we are controlling the latest outbreak with no infection case over the last 2 weeks. The total number of COVID-19 patients in Vietnam so far is just over 1,000, and most of them have recovered. And in Vietnam now, school, markets, tourist sign, bar and club have resumed operation. and we now can enjoy normal life again. And thank you very much for your listening.
Thank you very much, Lan Chu from Vietnam. Let's move on to the next speaker, Mohammed Al-Muhid from Yemen. Hold on, we have an audio problem, please. Wait seconds. It's okay? Can you say anything? We cannot hear you. Can you say anything? I think so. You have an audio problem, so we'll move to the next speaker. Sorry about that. I think you have an audio problem. So we'll move to the next speaker, Kubanibek Tavaldiev from Kyrgyzstan.
Hi, are you listening to me?
Yeah, perfect.
Okay, good. Hello, everyone. I am Kuban Abdimian from Kyrgyz Republic in Central Asia, and I'm glad to share my vision on the situation related to COVID-19, and will focus just in Central Asia. More than 70 million people live in the region across the 5 countries. With the onset of the pandemic, worldwide Central Asia also started registering those infected with the coronavirus, which led to a declaration of state of emergency in 3 countries first, Kazakhstan, Kyrgyzstan, and Uzbekistan in middle March, and then closing of borders for citizens of other countries. In the first 2 months, the situation was relatively stable, and the number of cases did not grow very much, an average 15-30 people per day. The healthcare systems of these 3 states were able to manage the situation, and patients were able to receive timely assistance. As a result, the death rate from COVID-19 was few people per day. Meanwhile, in 2 other countries in the region, Tajikistan and Turkmenistan, authorities did not take any measures. In Tajikistan, this happened in connection with the parliamentary election, which took place in early March, but quarantine measures were introduced only at the end of April. In Turkmenistan, the authorities have not yet taken official measures against COVID-19. Meanwhile, in the other 3 countries, the quarantine measures taken were eased in early June. This led to a sharp increase in the spread of COVID-19. 2 countries, Kyrgyzstan and Kazakhstan, felt this especially strongly. During this time, in Kyrgyzstan, 10 times as many people were diagnosed with the disease daily than during the quarantine time in spring. In Kazakhstan, the number of cases has increased by more than 20 times. As a result, today, the total number of cases in Kazakhstan has exceeded 105,000 people. In Kyrgyzstan, more than 44,000 people. Meanwhile, in Uzbekistan, the number of detected patients grew more smoothly, and their number did not exceed 40,000 for several months, and just recently exceeded 48,000, as mentioned by our colleague from Uzbekistan, Dilmurat. Unfortunately, the real figures in all countries can be worse. In first picture, we can see all data related to the dynamic of COVID-19 in Kyrgyzstan. In the first picture, you can see the maximum number of patients fell on the second half of July, when the daily detected number of patients reached more than 1,500. This lasted almost a month and reached a plateau at the end of August. At present time, the number of identified patients does not exceed 70-80 people per day. The total number of deaths reached 1,060 people in Kyrgyzstan alone. Unfortunately, these figures included some journalists. In entire region, this sad data reached about 3,000 people. Many media in the region had to work on distance for 4 months. Starting from July 20, patients with pneumonia were included in the patient's count. The second picture shows, please, second picture. the data for the Central Asian countries, where it can be seen that Kazakhstan and Kyrgyzstan count patients with pneumonia since July. Therefore, there was a leap in the schedule. Other countries are not yet doing this. In general, the situation with coronavirus in Central Asia is reached a stabilization level.
The time is up. Please wrap up your presentation in 10 seconds.
Okay, thank you. I'd like to make a conclusion. All countries of the region are preparing for the second possible waves. And Kazakhstan and Kyrgyzstan learned a lot of things here. In general, the region suffered economically most. The decline in the economies of the region countries can reach 5 or 10%, which will be notably affect the living standards of the region with 70 million people. That's it. I would like to say thank you very much.
Thank you for your presentation, Kvanikubet Dabaldievu from Kyrgyzstan. So next speaker is Jim Bomelha from United Kingdom.
Hello everybody, I'm Jim Bomelha, former president of the International Federation of Journalists. Let me first, if I may, thank the organizers for giving me this opportunity to say a few words on behalf of the IFJ. When I last spoke at the opening of the World Conference in 2015, the most topical issue was the future of journalism. I tried to lift the veil on the crisis of the economic model of newspapers everywhere in turmoil and how in the new media landscape, technology started changing journalism beyond recognition. But from the onset of COVID 8 months ago, this future has become even more uncertain. In a matter of weeks, the crisis has transformed life as we knew it. The great confinement, as coined by the International Monetary Fund, didn't leave any continental sector untouched, including a media industry already struggling. The economic shockwaves of the lockdown started pushing many media companies to the brink, jeopardizing the livelihood of staff, freelance reporters and photographers, and causing damage that could be irreparable, with many companies closing down and journalists everywhere suffered full impacts at a time when the value of proper journalism, impartial news and trusted editorial content is clearer than ever. Everywhere journalists amply prove the essential role they play, educating their citizens, contextualizing the non-ending number crunching, explaining the science, and most importantly, unraveling the narrative played by politicians, asking the tough questions, and exposing institutional failures when they occur. Everywhere, media workers demonstrated their vital role in the spectrum of essential public services by working around the clock to ensure the public has access to timely, reliable, and accurate information. Thanks to their engagement, journalism as a public good kept on thriving as the backbone of our democracies. And everywhere, many IFJ journalists union, like we heard from our colleagues in Somalia, fought hard to try and achieve significant progress and strong commitments from governments and employers' federation, not just to protect media, save jobs, and support the most precarious workers, but also to prepare the future of quality, ethical, and solidarity-based journalism. The IFJ coordinated much of this effort and launched on World Press Freedom Day last April a global response to the challenges to press freedom and journalists thrown out by the pandemic. I invite you to read the document, Global Platform for Quality Journalism, which you can find on the IFJ website. Supported by all the World Trade Union Federation representing several hundred million workers, this has now become an essential tool for IFJ members in 146 countries. The goal of the platform proposes a strong and immediate global stimulus plan to save the most badly affected media and help the most precarious journalists. It calls on all national governments to commit to quality journalism in this time of misinformation through strong political and economic measures that will ensure the survival of quality media and professional journalists. You will see in this plan detailed intervention and investment, such as action to stem the immediate damage being wrought and tackle historic wounds and prioritize creating a healthy, diverse press focused squarely on the public good to stand now and in the future. Thank you for listening to me.
Thank you for your presentation, Mr. Jinbu Mela from the United Kingdom. Next speaker is Hussan Weida from Germany.
Good afternoon, everybody. I would like to welcome you to my presentation in the frame of the World Journalists Conference of 2020 in South Korea. Next slide, please. To the outline, I have here 6 points: COVID-19, global responses, disease development, control methods, conclusion, and outlook. It has been almost 1 year since the virus hit the world with full force, and the epidemic occurred firstly in China, Wuhan, and turned into a pandemic across borders to the rest of the world, with no distinction if the countries are strong or weak, rich or poor. The global response was very various, and the infection also worldwide. We have different ways of infection control, but similarity in the long-term effects. Effects on health, society, economics, and politics are all known for you. And for this, we need cooperation between people and between the countries. Luckily, children and young people, but also women appear to be spared during this terrible crisis. To the disease development, we have here different approaches. Those varies in intensity, also worldwide. Firstly, as China declared Wuhan to no-go area, so we have taken this message seriously, and South Korea was a pioneer in COVID-19 testing. The motto was testing, so the Germany heard and saw that, and they followed the South Korean advice for a positive reaction and compliance in the population. Some other countries like the UK and the Scandinavian countries followed the principle of herd immunization with different results. We have sad news from some countries like Italy, Brazil, United States, India, and also Mexico because of the high number of deaths. The common control methods are known for you. You agree with me when we mention methods like closing borders, isolation of the suspected patients, identification of the hotspots, but also maintaining hygiene measures. All of them are medical methods, and we have also society afflictions or changes in the lifestyle. Here we can mention home office or homeschooling. That is a big change in our life, and we have to live with it. And the last not closed point is here in this sentence, the developing of vaccination and medication, where many pharma companies are still working on this, like Sanofi, but also Pfizer, Johnson & Johnson, and Sanders. As conclusion, we can say that corona will certainly not be the final infection of its kind. The world should be prepared to need and help each other. That is for the strong countries to help the weak countries. We should be able to benefit from innovative systems worldwide, just like know-how in screening methods, but also the establishment of intact health systems for the poor countries. The primary health care and the infection prevention is also important here. And one of the important points is the establishment and creation of early warning system on the global level. As outlook,
time is up. Please wrap up your presentation in 10 seconds, please.
Okay, thank you. We have to take those small organisms seriously. We have also to know how to deal with a situation like this in the corona time. And it is a high time to develop effective medication and protective vaccination, which should be made accessible to all people at realistic prices. Thank you very much for your attention.
Thank you for your presentation, Hussein Humeida from Germany. This time I will move back to the Mr. Mohammed Al-Muhid from Yemen. He had previously had the audio problem, so we'll back to the Mohammed Al-Muhid. Are you on the line? Please press unmute button. Please say, sir, I think it doesn't work. So sorry about that. We have no time for waiting, and so let's move to the. Sorry about the piece on this. Oh yeah, we can hear now. Okay, we can hear. Okay, go ahead.
Thank you very much. Okay, thank you very much. Just a moment. Thank you very much for everyone. As you know, we have, I'm sorry for saying that, we have a civil war in Yemen since 2015 until now. The only positive thing for this war is the aviation has been prevented from reaching Yemen since the beginning of that war. And therefore, we believe that COVID-19 was late in arriving to Yemen and did not arrive until several months later. Because of this war, the country in Yemen is divided into more than one region. Northern of Yemen is governed by Houthi militias, while in southern and central Yemen is governed by the legitimate government supported by the Arab coalition. In fact, the Republic of Yemen is one of the countries where there is no real plan to confront an epidemic as dangerous as COVID-19. The Houthi militia, which control the northern of Yemen, has continued for a long time denying the existence of this epidemic for several months, because the Houthi groups thought if their recognition of the existence of the epidemic in the Yemen, that means they have to stop the war and to deal with this epidemic. Also, the legitimate government has many problems in the southern and the center of the country. It tried in this area, southern and central, to control or to fight the epidemic with limited capabilities and try to set up a limited number of isolation centers and try to educate people through the media about the importance of social distancing. As people, we know that the COVID-19 exists in Yemen from the spread of the deaths during the country in a short period of time. From this science of deaths in the country, we know that COVID-19 exists in Yemen, whereas the Houthi group deny that COVID-19 does not exist. Also, the legitimate government say there is no evidence that COVID-19 exists in the country. I can conclude all of this situation in Yemen. The Yemen is in one way or another, has followed the method of herd immunity, and that this point can be a good point or a good country to study the meaning of herd immunity to confront the epidemic of COVID-19, because both parties.
The time is up, so please wrap up your presentation in 10 seconds, please.
Okay, I mean that the situation in Yemen is a good example of the herd immunity if anybody wants to study the COVID-19 without any human conference. Thank you very much.
Thank you for your wonderful presentation. Thank you so much. Now we have a last presenter from South Korea, who is Hong Hae-gar. He's, as far as I know, he's one of, I think it's the first doctor turned medical journalist in Korea, I think, and he's also a reputed commentator on medical issue in Korea. So, and he's doing his own business in here, and his presentation, he will present in Korean, and his presentation will be translated into English simultaneously. Mr. Hong, stage is yours.
안녕하세요, 홍해걸입니다. 대한민국은 코로나 방역에 대해서 전 세계적으로 아주 좋은 평가를 받고 있습니다. 저는 세 가지 이유로 요약을 할 수 있는데요. 첫째는 지금 이제 마스크가 중요하다는 건 모든 사람들이 알고 있는 상식인데요. 제가 아는 한 대한민국 국민들은요, 마스크를 정말 잘 씁니다. 굉장히 훈련이 잘 돼 있고요. 아마 마스크 쓰는 능력으로 보면 세계 탑 레벨이다라고 말씀드릴 수 있을 정도입니다. 저도 이 마스크를 지금 쓰고 있는데요. 이 마스크가 단순한 면 마스크가 아니고 미세먼지까지 94%를 걸러주는 보건용 마스크입니다. 처음 쓰는 사람들은 굉장히 숨이 답답하고 힘드는데 한국의 많은 국민들은 이런 마스크를 쓰는데 굉장히 익숙해져 있다는 얘기죠. 이유는 이제 몇 년 전부터 대기 오염, 특히 미세먼지가 굉장히 심해서요. 대한민국 국민들은 이런 마스크를 수십 장을 사갖고 집에다 비치하고 다니면서 외출할 때마다 수시로 썼고요. 또 옛날에 우리나라는 메르스라든지 또는 신종플루처럼 해외에서 유입된 바이러스 질환을 두 차례나 대규모로 경험한 적이 있습니다. 수십만 명이 걸린 적이 있었는데요. 그런 과정을 통해서 마스크를 쓰는데 잘 훈련되어 있었다라는 걸 말씀드릴 수 있습니다. 그리고 두 번째는요, 우리나라 의사들이 짧은 시간 안에 많은 시술을 하는 데 익숙하다. 이유는 수가가 낮기 때문입니다. ERCP라는 굉장히 테크닉이 어려운 내시경이 있습니다. 이게요, 대한민국 대학병원에서는 교수 한 명이 1년에 1000케이스를 합니다. 1년에 1000케이스. 근데 미국에서는 병원 하나가 1년에 150케이스밖에 안 합니다. 이유는 미국보다 한국의 수가가 10분의 1로 낮기 때문에. 그래서 한국의 의사들은 이렇게 짧은 시간 안에 많은 검사나 시술하는데 굉장히 익숙해져 있고, 이런 것들이 코로나에서 검체를 채취하고 시술하고 치료하는데 큰 역할을 발휘했다라고 생각을 합니다. 그리고 세 번째는 질병관리본부 리더십이죠. 유행 초기 때 진단키트를 대량 생산하도록 민간업체를 독려했고요. 또 동선 추적을 빨리 해서 확진자를 찾아내 확산의 속도를 줄였습니다. 그런데 잘한 것만 있는 게 아니고 제가 볼 때는 몇 가지 못한 것도 있습니다. 비판인데요. 첫째, 초기 중국에서 좀 더 일찍 입국 금지 조치를 내렸어야 옳았다라는 점이죠. 만일 우리나라가 그랬더라면 지금의 대만이나 베트남이나 싱가포르나 뉴질랜드처럼 훨씬 더 좋은 성적을 냈을 것이다 라고 생각을 합니다. 둘째는 사생활 침해죠. 대규모 집회라든지 클럽 참가자처럼 고위험군의 경우에 심지어는 휴대전화 기지국을 통해서 개인의 통신 사실을 추적하게 됐다는 얘기죠. 이 과정에서 불륜이나 동성애 뭐 이런 것들, 민망한 개인적인 프라이버시까지 폭로되기도 해서 곤욕을 치르기도 했다는 얘기입니다. 그리고 마지막은 이제 언론의 분열이죠. 코로나에도 우리나라도 여지없이 너무나 과도하게 정파성이 개입이 됐다. 친정부 매체는 정부를 지나치게 찬양하고 반정부 매체는 과도하게 힘집을 냈다라는 것을 말씀드릴 수 있겠습니다. 고맙습니다.
Thank you for your wonderful presentation, Mr. Hong Hae-gar from South Korea. Actually, we are supposed to have a Q&A session in this presentation session, but we have spent too much time on presentation, so we'll first take a 15-minute break. We'll take a around 10-minute break and back here at 5:15, and we will begin the next section with the Q&A session, and then right after that we will have a debate. So have a break time for 10 minutes and back here at 5:15. Hello, ladies and gentlemen. Now we'll begin the second part of today's conference, which will begin with the Q&A session that we had to be done in the early part of the conference. So we will begin the second part of the conference with the Q&A session. For this session, we now have a very special guest, Kwon Jun-wook, from Director of Korea National Institute of Health. Please welcome Director Kwon. Director Kwon, are you on the line? Sorry, yes. There is some problem.
Hello, this is
okay.
Can you hear me?
Yeah, is everything perfect? Yeah. We can hear it clearly. So first of all, please could you give a welcoming remark for the international journalists who are on the line as well. So could you give a welcoming remark for them?
It is my pleasure and honor to be here through the telemedicine, and I'm the Deputy Director of Korean CDC, and I'm responsible for COVID-19 control and prevention in Korea. So it is my pleasure and honor, and also I welcome all the participants' concentration on my presentation. Thank you so much.
Thank you so much. Actually, there's a lot of questions that the journalists have gave it to you, but I will select just 4, and I will give it one by one. Yes. Could you give us up-to-date information about coronavirus vaccine under development in South Korea?
Yes, in Korea we have 3 pharmaceutical companies are on the track of developing COVID-19 vaccines. Among them, only one company is on the clinical trial 1 and 2A. It's a kind of nucleic acid platform. And the remaining 2 are just preclinical stage. Korea is not front runner. However, we will go through at the final stage of COVID-19 vaccine development. As our Mr. President committed to the people, we will purchase, regardless of the timing of the development, we will purchase all the vaccines produced by pharmaceutical companies in Korea if they passed clinical stage 3 trials. So that's an opportunity to nourish the Korean pharmaceutical industry. So that's the status of COVID vaccine development in Korea.
Okay, thank you for the answer. I'll give one more question about the regarding vaccine. We all know this. Russia claimed it has developed a vaccine, and there are several other vaccines under development in China and also elsewhere, including the United States and Britain and other countries. But among them, what's your take on the vaccine in terms of effectiveness of one vaccine from Russia and the other things from China?
Well, actually, it depends on the results of clinical stage 3 trials. Depends on the results and scientific evidence. We have all 9 candidate vaccines on the line of the clinical stage 3. Among them, I know that 4 from the China and 1 from the Russia. And among 4 from the China, 3 are inactivated, and 1 is just a vector platform. Also, Russia is the vector platform. So we are observing the results of clinical stage 3, and after reviewing the results, we will contact them, and we will start the bilateral conversation. So we are open to any pharmaceutical companies. Only we are watch out the results of the clinical trials.
Thank you for the answer. The next question is about WHO, World Health Organization. We all know there's a criticism over the role of WHO in response to the COVID-19. How do you assess the role of WHO in fight against COVID-19? Does it doing a good job or bad job?
Oh, that's a very straightforward question for the public officer in Korea right now. I want to say that WHO could have more strong and the right direction of the leadership based upon WHO constitution supported by all the member states. So in this COVID-19 struggle, I expect WHO more strong leadership in terms of equity and accessibility, equality to the vaccine supply. So in every areas of public health area, WHO more speak up, and I wish show more strong leadership.
Okay, thank you for the answer. This is the last question for you. This is a comparison between the United States and Korea. Actually, the first case of each country was reported quite the same day. I believe, as far as I know, it was a one-day gap between the US and Korea. But the result is quite different. In Korea, we all know that it's quite relatively good. The virus is relatively under good control. And meanwhile, the US we see a very catastrophic outbreak of COVID-19 in the US. And what do you think has made it that huge, vast differences between the two countries?
Until now, it's not the end of COVID-19, so nobody knows the final grades. However, just I remember at the very early times of COVID-19, we, Korean, focused on very strong contact tracing and epidemiological investigation and quarantine based upon very nationwide early started laboratory testing of real-time RT-PCR. So that's the one factor to suppress the COVID-19 outbreak. Maybe compared to the United States, very large size of country and so many population, so I don't know what is the exactly factor to make this shape of COVID-19 nowadays. However, in Korea, I emphasize again very strong contact tracing, epidemiological investigation, and very nationwide and expanded laboratory testing capacity. So that's the main factor to maintain this level of COVID-19 outbreak in Korea.
Thank you, Director Won, for taking the time for this interview. And stay healthy and stay strong. Thank you so much. Okay, we just had an interview, brief interview with the Director Kwon Jun-ho from the National Institute of Health. Oh, so for next turn, I would like to give the same question to the Mr. Hong, who is sitting next to me. Could you give us could you speak to your opinion about the question that I asked? I will give the first one. How do you see what drives vast differences between the U.S. and Korea in terms of the outbreak of COVID-19? What made it big differences?
저도 굉장히 좀 의아합니다. 왜냐하면 코로나 초기 때 미국 존스 홉킨스 대학에서 세계 보건 방역 지수, 그러니까 글로벌 헬스 인덱스라는 걸 발표하는데요. 여기서 세계 1등이 미국이었습니다. 그리고 대한민국은 8등이었단 말이죠. 그러니까 객관적인 지표로 보면 전염병에 가장 잘 대처하리라고 믿었던 평가받은 국가는 미국입니다. 그런데 결과는 말씀하신 대로 완전히 거꾸로 났고요. 그래서 저도 예측을 틀렸습니다. 근데 이제 그 이유를 꼽아보면 여러 가지가 있겠지만 저는 첫 번째로 좀 리더십의 부재였던 것 같아요. 미국 대통령부터 CDC 또는 미 국립 알레르기 감염 연구소장부터 많은 전문가들이 마스크에 대해서 엉뚱한 이야기들을 많이 내놓더라고요. 쓸 필요 없다. 숨만 열심히 씻으면 되고 마스크는 쓸 필요 없다. 무슨 논문으로 검증이 안 됐다. 근데 저희들은 굉장히 이상하게 생각했습니다. 적어도 한국이나 아시아 국가에서는 마스크가 분명히 방역에 도움이 되는데 왜 저런 소리를 할까? 저게 과연 evidence based medicine 저것만 강조하는 게 옳은가? 지금 막 전 세계에서 수백만 명이 막 참고를 하는데 잘 짜여진 논문이 없다는 이유만으로 마스크 무용론을 내세웠단 말이죠. 그러다가 나중에는 어떤 웃지 못할 해프닝도 있었냐면 여러분들도 뉴스를 보셨겠지만 미국의 서전 제너럴이 이 셔츠를 갖고 와서 가위로 오려갖고 마스크를 만드는 걸 국민들에게 교육하는 영상을 보여주더라고요. 이게 얼마나 처참합니까? 그러니까 세계 최고 나라인 미국이 마스크가 없어갖고요. 나중에는 인정을 한 거예요. 두 발 다 들고 마스크 필요합니다. 근데 없으니까 그제서야 집에 있는 셔츠를 가위로 오려갖고 마스크 만드는 거 교육하고 제가 그걸 보면서 미국이 저렇게 속절없이 무너지는 게 이유가 있구나라는 생각을 했고요. 또 하나는 진단키트 같은 것도 마찬가지입니다. 이게 저도 아직도 믿기지가 않는데 미국이 중국에서 유행하고 입국 금지하고 한 달 정도 시간을 벌었습니다. 근데 그동안에 진단키트를 대량으로 많이 만들고 이렇게 했어야 하는데 그때 오염 문제가 발생합니다. 그래서 미국 정부에서 주도한 진단키트 시제품이 심지어는 생리식염수에도 양성 반응을 보였다는 거 아닙니까? 이게 말이 되는 얘기입니까? 저는 지금도 왜 그랬는지 믿어지지가 않고요. 이런 총체적인 리더십이나 시스템의 부재 이런 것들이 한국과 미국의 큰 차이를 낳았다라고 생각을 합니다.
Okay, thank you for the great answer. This is the next question for you. Director Kwon said he finds this question quite tricky to answer, but I think you can give a more straightforward and more detailed answer to this question because you are a little bit independent from the government. So it's about also WHO, the World Health Organization. You know the criticism that's spiraling around the world about the role of the WHO and suspicion about the political forces behind this organization. You may know that. How do you see the role of WHO in fighting against COVID-19? Good job or bad job?
예, 저는 좀 비판적인 입장입니다. 뭐 한 C학점 정도. 뭐 단적으로 말해서 그 글로벌 팬데믹을 조금만 더 일찍 선포했더라면 아마 더 피해가 좀 더 전 세계적으로 줄어들지 않았을까 생각을 하는 거고요. 알다시피 이제 세계보건기구의 수장을 비롯해서 사무총장이죠. 이런 분들이 어떤 분들은 의사이기도 하지만 전문가이기도 하지만 어떤 분들은 그냥 정치인들이 지역 안배로 되잖아요. 그래서 전문성에서 좀 의심되는 경우도 저는 많았다고 보고요. 또 특히 운영 재정과 관련해서 특정 국가에게 너무 편중돼서 그 특정 국가의 좀 더 우호적인 그런 판정도 많이 내리지 않았나 그런 비판을 받을 수 있다라고 생각을 합니다. 어쨌거나 이번 그 글로벌 그 코로나 팬데믹을 통해서 세계보건기구는 전면적인 그 개혁과 혁신이 필요하다고 생각합니다.
Thank you for your answer. This is a question for Antonio in Italy. The question is, there's a huge catastrophic outbreak of COVID-19 in Italy. So the question is there any government official punished as a result of this catastrophic outbreak of the virus? And if it's the case, what kind of punishment they get, or if it's not the case, what kind of measure they need? So please give us information about this question, Mr. Antonio.
Thank you. Justice is moving. For now, there are some investigations by the prosecutors in Milan. Milan is the capital city of the region of Lombardy, the most affected area in Italy. And there are some investigations also about the central government of Italy, but no investigation yet about the role of health experts in Italy. Because in the very beginning of the pandemic in Italy, the experts underestimated the pandemic. So we have investigations now, and for now, no punishment, but we have to wait because in our system, justice needs time to have some conclusions.
Thank you for the answer. This is question for Haini in Israel. Are you on the line? Yeah. Okay. So we know Israel is quite religious countries, and the power and influence of religious leaders is quite huge, right? So the question is, we know medical experts are doing their best to fight the COVID-19, but the question is, what is the role of religious leaders in Israel in fighting against the COVID-19?
Well, the religious communities in Israel were affected very hard from the pandemic with a high infection rate since the beginning of the pandemic. And Bnei Brak, one of the biggest religious cities in Israel, was the first to be under local lockdown. Now, there were several reactions from the religious leaders and from the religious public during the first wave in March to May. Most of the elected officials, like mayors or members of the Knesset from the religious communities, pressed the public to comply with the regulation. But the problem was with a few radical religious section leaders who refused to comply, and they told their people to continue as usual in religious school, parties, and it's helped the infection rate to go to skyrocket eventually, and affected all the countries, And eventually they changed their mind, and it's helped to reduce the infection rate during April, May. Now, it's important to note that because the religious parties are part of the race of Prime Minister Netanyahu's ability to fight the pandemic. For example, earlier this month, there was supposed to be local lockdown in dozens of cities, many of them religious, but pressure from religious leaders and the threat from the religious public not to comply, not to obey the rules, forced the government to decide instead of lockdown on a night curfew instead. Now, from this coming Friday, as I said, there's the second lockdown, the second national lockdown in Israel, and it will be in parallel with the holiest period of the Jewish calendar, Rosh Hashanah, the beginning of the Jewish New Year, and other holidays. And it caused some tension between the religious leader and the government. And even inside the government, when one of the religious ministers resigned, because he told that the lockdown is aimed against the religious communities. Now, the main question was how many people can participate in prayers, especially inside the synagogues, because there are more attendance of praying people during the holidays. The new rules cut the numbers of the praying people, but still higher than the recommendation of the professional expert. And this also caused some anger from businesses owners and the secular communities in Israel, because they feel that the religious people can still have their place inside building and everything for the prayers, and they need to close their businesses. They need cannot do the usual stuff, even go to the beach, go to restaurant and everything. And this co-intention I see is another negative effect of the pandemics, and it's going to affect very much of the society in Israel.
Thank you for your answer. And there are just 2 questions left for me, and after the 2 questions, we'll have a debate session. So in the debate session, if you wish to speak during the debate session, please leave your name and nationality in the Zoom chat box. I'll pick up speakers on the first come and first served basis. So if you want to say something, please leave your name and nationality on the chat box right away. I'll pick speakers on the first come and first basis. So let's move to the 2 remaining questions I have. This is for the 2 questions is for the same person, Mr. Habib from Bahrain. Are you on the line?
Yes.
Yeah, this is 2 questions for you. The first one is the cost of the economic cost. How much the negative impact in economy the Bahrain has received as a result of the pandemic? Simply put, the cost of economy due to the pandemic.
Yeah, and the first, as soon as the pandemic reached Bahrain, the government announced for $11.4 billion economic stimulus. In June, this stimulus was added for another 3 months. It covers mainly people working in the private sector and businesses helping people to make sure they stay afloat during the economic downturn.
Okay, thank you for the answer. The second question is about the impact of COVID-19. We know that Australia is one of the countries that is suffering from the COVID-19 outbreak. And while taking control of the virus, is there any issues that has compromised the freedom of press and the core principle of a democracy?
The most important thing during the coverage of the COVID-19 in Bahrain was to make sure there are no fake news. There were attempts, of course, at misinformation, disinformation, and even malinformation attacking certain people, but these were especially from abroad. The government and the newspaper owners and editors agreed to go only for authentic news. Any news that cannot be authenticated by experts, I'm talking about medical experts, then it will not be published. So there was no real pressure on journalists. At the same time, journalists had training sessions by the Bahrain Journalists Association and by some people about how to deal with situations, like when they talk with doctors, how they can challenge doctors to make sure they have the right information. When they talk with patients, they encourage patients to tell them exactly what's happening, and also to deal with pressure themselves. You know, for example, make sure that on your phone, on your mobile, you keep some music, something, so that when there's a lot of pressure, you stay aside for some time and you listen to that, or you watch something that you like to watch for a couple of minutes, and then you go back to work, so as to ease the pressure. So for journalists, there was no pressure, honestly, from anybody asking them to go one way or the other, and themselves, the journalists themselves, were driven by the high sense of responsibility. So they knew they were fighting a war and this infodemic, so they had to be very, very vigilant and to do their best to make sure there's no panic in the country. And as far as they know, it had succeeded.
Thank you so much for your answer. So now we'll go straight to the debate session. As I mentioned earlier, any people who want to speak thought you have in mind, please leave your name and nationality in the chat box, and I will pick up speakers on a first come and first served basis. Now we have 3 people in waiting line, and there's a first. I will give the mic to the first person, who is Keshab. That's right, Keshab Prasad Hodu from Nepal. Excuse me, you have an audio problem? Hold on, could you press unmute button? Please press. Okay, now we can hear you.
Thank you very much for giving me this opportunity to speak something about Nepal, because one of my colleagues has already mentioned the state of Nepal, COVID situation in Nepal. Just listening, the Korean colleagues, but I realized that the mask is a mask panacea for against COVID. That what I get from I get a message from one of your colleagues. So far in our country, people are wearing masks almost everywhere. But the problem is thinking that the mask is panacea against COVID-19, and that is causing a lot of problems. So I think we journalists also need to be clarified that the mask is not a. Let me if countries in the regions have mask, getting mask and catching this pandemic. If you have some story, let's say. Thank you very much for the service.
Thank you for your opinion. So next speaker is, wow, that's quite long. Ashraf Yazid Dali from Egypt. Yes?
Thank you. That is, yes, thank you. Is it okay here?
Yes.
Okay. Actually, it is long, so you can use the abbreviation of Ashraf Dali.
Okay.
Now we have a debate on the vaccines. This is the era of talking about the vaccines, because first we were suspicious and worried about the presence of COVID-19 at all, whether it is real virus, lab manufactured virus, or is it existing at all? Is there something called virus? Now we are in step 2, which we are reaching the virus stage and the vaccine one. What country will be offering? How much will it cost? Will it have dangerous consequences? So the first group of questions are still on debate. You can realize it on Twitter, Facebook, everywhere, studies and studies against the first collections of studies, researchers and rumors and conspiracies. So we will not have a full answer about the first collection or whether COVID has this superpower against us or not. So the vaccine, I think, will continue this suspicious era. And we as journalists, we are seeking truth. So who are going to give us such truth? Will it be the ministries of health everywhere, which now people are suspected the numbers of victims everywhere? Will there be the medicine factories? Will it be the WHO? Who is going to give us the final answers of our worries and the questions about the vaccine, which are reaching its era now? Thank you.
Thank you for sharing your thought. Next is Margaret Ozalvo from Colombia.
Hello, how are you? You can listen to me?
Yes.
Okay, hello everybody. It's a pleasure to be here and to enjoy the fantastic conferences and points of view the speakers gave us today about the COVID-19 or coronavirus, however you want to call it. It's been an important moment of our lives. We are making history. We have learned every day about how to manage to live and to dream a new solutions of this situation of COVID-19. Pharmaceutical labs, doctors, scientists are working so hard to find vaccine and treatment for this COVID. But in the other hand, okay, we are now suffering. Many people are died, and many people is ill. In my country, Colombia, we had 700,000 people infected, but fortunately, the 90% are okay now. We have at least 20,000 people that die, and we understand, as Latin American country, many things about this. This is an opportunity, and I want to face one side that maybe we don't talk too much about this today, is technology. How technology could help us to survive, to work at home, to make our financial movements, and help us to be connected. For example, this magnificent moment here at WJC2020 to share with at least, I think, 100 journalists from all over the world, thanks to technology. Digital transformation arrives so fast when in March or February we have to lock down, and we have to understand that technology is one of our greatest tools. So I want to point here on the table that technology is the opportunity, is a good side of the story, and most important, we all have the opportunity also to grow, to learn about this, to understand the new way we are going to share our fantastic planet, Earth, and the way to live from here to the future, being more close to the neighbors, the people, the humanity. Now we are in a distance, but we understand the importance that you are important to me, and I am important to you. Everybody in the world is important to each other. So work together, learn so much from this moment, and thank you very much for this fantastic conference. To Korea, it's in my heart, and thank you very much. Technology is the opportunity.
Thank you for sharing your thought, and thank you so much. Actually, now we have only 9 minutes left for today's conference, but people who want to speak, is we now around 5 or 6. So, if possible, I would like to give all of them the opportunity to speak about their thoughts. So, if possible, please speak as quickly as possible, and just go straight to the point you have, and then toss the mic to the next person. So the next speaker is Sabina Inderjit from India. So what's the point you have?
Yeah, the quick point that I want to make is that this particular debate in this session has talked about how the government has tackled COVID, how the media has helped the government in tackling this problem. I think the question that we need to move forward with is what my colleague Jim has mentioned, in which the RJ has been flogging, is the fact is that the media has helped their governments vis-a-vis educating people, helping it fight the COVID. The question is, have the governments given that economic stimulus to the media as well? The question is, today there are layoffs. COVID has impacted jobs, layoffs, salary cuts, and as we as journalists and we as media houses have to ensure that this is going to impact democracy at the end of the day. So the quick and short point is, colleagues, we've discussed government role today, we've discussed media's role. I think we have to go ahead and look at and demand from our various authorities and our governments to ensure that the stimulus package which they're giving to the private industry, to public institutions, media has to be a priority as well.
Thank you for your thought. And the next speaker is also from the India, Ranjit Kumar.
Hello, am I audible?
Yes, perfect.
Just to add to Sabina and Ajit's point of view, see, because of the COVID-19 pandemic, media industry was the worst affected in India, one of the worst affected sector in India. See, one of the interesting anecdote I would like to tell you, when this lockdown was imposed because of COVID, the rumors were spread all around that newspapers were the biggest carriers of coronavirus. So people stopped buying newspapers, and then circulation of the newspapers dropped very much. The revenue also, advertisement revenue also dropped very much. and media industry started sacking the employees or export. So that was the most worst affected media industry in India because of COVID sector, and that has resulted in mass unemployment. Many of the industries, media industries, newspapers, television channels, they sacked their employees and because of their reduced revenues. Thank you.
Thank you so much. And I will invite just one more speaker to this podium because we almost at the time for today's conference is almost over. So the next speaker is China. But before giving the mic to the speakers, I'd like to say that tomorrow is the last day of this year's conference, and in the second part of the conference tomorrow, we will also have this kind of debate session. So those who want to speak your opinion, you can come here tomorrow, and then you can, if you leave your name and nationality the same way you did today, I'll pick you up for the session, and then you will also have an opportunity to speak your thought to the other audiences. So please keep in mind that there's an opportunity you may have tomorrow. So last speaker for today is Chen In-gun from China.
Hello, can you hear me clearly?
Yes.
Okay. Yeah, I just want to respond to the question about media's role in promoting global cooperation in the fight against the pandemic. According to my observation, I think Chinese media has done much in regard. For instance, since the coronavirus outbreak, the China Journalists Association, together with some Chinese media, have offered help to journalists associations in many countries, such as Poland, Russia, Central Asia, and Latin America, through ways including donating anti-epidemic supplies and share with them information. And Chinese media have also done much. The media I'm working for, China Daily, has also done much. So in April, China Daily has published a report, China's Fight Against the COVID-19, that detailed the country's measures to combat the outbreak and provide health workers and officials around the world with data they could draw on to respond more effectively. And China Daily has also held several Vision China events to provide a platform for leaders and experts to share their insights on the pandemic. And there are a lot of things that we have already done. Just for your reference. Thank you very much.
Thank you for your thought. And I would like to wrap up today's conference. It was the second day of World Journalist Conference 2020. We thank everyone who participated in today's session. As I mentioned, tomorrow you will have another. I'll give you an opportunity to speak your voices to other audiences tomorrow. So keep in mind that and come to tomorrow conference. So tomorrow the topic we'll discuss is 70th anniversary of the Korean War and the peace policy on the Korean Peninsula. So we will send you an invitation through your registered email at 2 p.m. Korea Standard Time, which is 1 hour before the conference. As I mentioned, tomorrow is the last day of this year's conference, so I want all of you come again and have you enjoy the productive, informative time all together. So thank you for your participation, and we'll see you tomorrow at the same time at the same place. Thank you.